Hello, and thank you for joining us today for our presentation. My name is Nicole Roma from the University at Buffalo School of Nursing, and I will be presenting today with my colleague Sabrina Kasuchi. So the title of our poster presentation is Engaging Patients in Integrated Behavioral Health in Primary Care, a technology-based system to facilitate behavioral health screening in rural and underserved areas. So our project focuses on integrating behavioral health into primary care. Integrating behavioral health into primary care can increase patient access to mental health and substance use disorder treatments, and this can be especially true for rural and underserved areas, since most of the time specialty clinics may be located far away and patients may lack transportation to get to these clinics. And screening for these common behavioral health conditions really is an essential part of behavioral health integration. It is, what pretty much gets the process rolling and allows people to identify patients that are in need of treatment. The screening tools, so these are typically filled out by the patient in the waiting room using a paper screening tool. So although screening is the best way to measure a patient's symptoms, there are some challenges that can be associated with using paper-based screening tools. This includes a time-consuming process for manually scoring and entering the screening data into the electronic health record, a difficulty in retrieving and using scanned screening data in the electronic health record since it is not discrete data, and then also the potential time delay in screening completion and review by clinical staff. So the provider may be very busy and not have the time to wait for the patient to finish the screens before they see them for their visit. So a solution to this really is using technology for screening. And carefully designed technology has the ability to facilitate patient screening and also the integration of behavioral health screening data into routine primary care. So what our team did is we partnered with a rural and underserved health system in New York. We built an interprofessional collaborative practice in their primary care setting. We then created a technology-based screening system using tablets to facilitate behavioral health screenings within the clinic. So this tablet screening, it provided patients with an opportunity to effectively complete multiple behavioral health screening tools and for the clinicians to review the patient's summarized results prior to the patient's primary care exam. So this gives the provider the ability to speak to the patients about their results and then also provide a brief intervention and referral to treatment if it is needed.
I think we can all agree that paper-based screening tools are an inefficient tool, and this is from the perspective of the patient as well as the clinic workflow. Further, because these forms are typically stored as documents in the EHR, they have limited usefulness when preparing for a pending exam or tracking patient progress over time. Our tablet-based screening process was designed specifically to address these limitations, providing a more effective and efficient means of collecting and analyzing screening data and supporting primary care clinicians in addressing behavioral health concerns during a scheduled primary care visit. We recognized that this new system must not add undue burden to clinic staff, workflow, or patients in order to be sustainable. Therefore, we used a skip logic approach requiring all patients to complete a mini screen tool at once every 30 days. This tool presents the PHQ-2, GAD-2, Audit C, and one DAST question, assessing patient risk for depression, anxiety, and substance use and abuse. Full screening tools are immediately presented only for those patients whose mini screen results indicated additional evaluation is warranted. For example, if a patient's mini screen indicated concerns about depression and alcohol use, but not anxiety or drug abuse, then they would immediately be asked to complete the full PHQ-9 and audit, but not the GAD-7 or full DAST screening tools. To reduce the burden on clinic staff, we also developed logic for administering and monitoring the process. This includes creating a daily roster of patients who have scheduled appointments and who are eligible for screening. This list can also be used to initiate the screening process by the registration staff or the nursing staff as appropriate. Once the patient confirms their identity, they can easily navigate the tablet website interface and complete the required questions. All screening occurs in the clinic waiting room or exam rooms, and therefore all data collection and transmission occurs on secure networks. Patients' responses to screening questions are immediately transmitted and stored in the patient chart as discrete data elements. Data is then automatically analyzed and summarized for clinicians, providing a summary of concerns in the banner area of the patient chart so that clinicians can quickly identify what follow-up might be needed as they prepare for the exam. When needed, clinicians can view the fully detailed results through a note that is automatically generated and stored in the patient file. Similarly, a flow sheet or spreadsheet view of the results is also available, allowing clinicians to get a quick yet detailed understanding of patient progress over time. Because data transmission, processing, and alerting is immediate, the clinician can view these results in the appropriate detail prior to entering the exam room. Areas of concern can then be addressed during the visit with a warm handoff to a behavioral health counselor completed when appropriate. Because we were able to automate much of the management of this process, we removed a lot of the burden for system administration from the clinical staff without dramatically changing the clinic workflow. We used a phased approach to system rollout, launching the process with individual clinical teams over a period of several weeks. We provided hands-on training with clinical staff so that they understood both patient and clinician interactions with the system and could effectively administer and troubleshoot the system with patients. We also provided on-site support and periodic retraining and feedback sessions to review critical details, address concerns, and further support system integration. This approach helped to ease clinician concerns about using and understanding the technology and ultimately helped to achieve adoption and sustained use of the system.
So we learned that our tablet system can efficiently facilitate patient screening within the primary care setting. The automated screening scheduling system that was created ensured that every patient was assessed for behavioral health conditions within the proper time frame. With the ability to track patient results, the care team is able to more effectively understand and manage the behavioral health needs of the clinic patients. Electronic health record integration of patient screening data allows the primary care provider to more effectively speak to patients about their results because of an automatic upload during the visit. It also provides them the ability to give a warm handoff to integrated behavioral health services if needed, also during the visit. And by digitizing the screening process, the clinic workflow associated with the integrated care process can improve. So the tablet-based screening system that we created may provide a solution to really identifying patients with behavioral health conditions in the primary care setting. We also learned throughout our implementation process that a clear and easy to follow screening process is crucial for the technology in order to be widely accepted by patients and also by clinic staff. And that is the end of our presentation. Thank you so much for attending, and please feel free to reach out if you have any questions. Thank you so much.